Thanks everybody for joining us for another episode of Skooled podcast. Today I am joined by Dr. Adrienne Phillips. She is an assistant professor at Weill Cornell, New-York-Presbyterian of Hematology and Medical Oncology, and she is the perfect person to help us tackle an issue that is probably near and dear to many people's hearts, including some of our listeners, and that is the increasing prevalence of cancer and specific types of cancer among young adults, and in particular millennials. Research is showing that millennials and young adults are seeing higher incidence, especially of obesity-related cancers. I personally have several of my friends, peers, people in my age group, millennials, who have different forms of cancer, and then in particular aggressive forms of cancer. And it became so prevalent in my own social circles that it made me wonder what the heck is going on. Why are we seeing this in otherwise what appear to be healthy individuals? So I've asked Dr. Phillips to come on our podcast and help us wade through this sort of difficult subject. It can be emotional as well. But first, Dr. Phillips, why don't you introduce yourself and tell us a little bit about your background and what you specialize in?
Sure. Thanks, Nia. So I am a board-certified hematologist and medical oncologist. Hematology is the study of blood diseases, and medical oncology is the study of cancers, which are malignant tumors. I have been in practice 12 years. I am based in New York City at Weill Cornell New-York-Presbyterian Hospital, where I work in the Department of Medicine, Division of Medical Oncology. And there my focus is actually on blood cancers, so leukemia, lymphoma, multiple myeloma, and also bone marrow transplant. But I've definitely treated all different types of cancers, including what we call solid tumors, which are like the top three: breast, colon, lung, prostate in men. So I'm happy to be here with you to chat about this.
Thank you. So in doing some research, I realized that a study came out recently that showed that, sort of mirroring the increase in obesity rates in the U.S., are also an increase in certain cancers among people under 50 years old, especially cancers that we're used to hearing about in older adults. And this study, I believe it was done by the American Cancer Society, it looked at rates for 6 of 12 cancers related to obesity. And it was really interesting that it found an increase among certain types of cancers, and especially among in the millennial age group. So colorectal cancer was one of those cancers, endometrial cancer, gallbladder, kidney, pancreas, and multiple myeloma, which is something that you said you have experience in. And so I'm wondering if you can help Dr. Phillips explain to our listeners, because as I mentioned, it's not just the study, we're seeing it in real life. We're seeing our friends, our peers get cancer and then aggressive forms of cancer. So what is the relationship between obesity and these particular types of cancers?
Sure. So first, I guess we should take a step back and talk about what is cancer. So cancer is a disease caused by an abnormal growth of cells, and these cells can take place or grow in any part of your body. And, we're learning more and more about risk factors for cancer, but it's a very complicated process, and your risk for developing cancer is partly to do with your genes and what you've inherited from your ancestors, but then it's also your environment and what you're exposed to, and whether it's foods, it's medications, and certainly the obesity epidemic in the last 50 years has been something we would call environmental, that is increasing rates of these certain cancers that you outlined. So the risk in this study for cancers among millennials, which are, I guess, less than 50, is that considered a millennial?
So millennials are usually born in like the early 80s to like the 90s. So I guess the oldest millennial today would be about 38 years old.
Gotcha. Well, cancer in general is a disease that we see among older people, and I'm an adult oncologist. Certainly cancers can occur in the pediatric population, but it's much more commonly as you get older. So if we're talking about cancers that are occurring, among that millennial age range, we're looking at cancers that they might have different environmental exposures to be at risk for. And in this Lancet study, they found that those 6 cancers that you mentioned, which have been proven to be associated with obesity, not necessarily caused by obesity, but associated with obesity, were heightened in the millennial population.
So what does it mean when we say associated with obesity? So obesity isn't the culprit, but it plays a part in perhaps being diagnosed with these forms of cancer?
Yeah, so it's hard to tease apart. Like, certainly it's now hypothesis generating, and people who are obese may be at risk for developing cancers, but certainly there are people who are obese who will not develop these cancers. So we don't say that it's causal, but there are associations, and it certainly should make primary care doctors and people in general be conscious of what risk factors they can modify to hopefully lower their rates of cancer. And certainly diet and exercise to help control obesity would be those recommendations.
So it's saying that there is an increase in obesity, and that increase sort of mirrors this increase in these 6 different types of cancers. So are we saying that younger Americans are increasingly obese, and there is a correlation there with younger Americans developing certain types of cancer?
So again, it's not causal, and I do have to say, I want to start with a positive statistic that cancer rates overall are decreasing among the American population.
Right.
And I think what's concerning about this study is that the risk for the younger population, perhaps associated with obesity, but also perhaps associated with other risk factors that have yet to be defined, we're seeing these, 6 cancers that are being diagnosed more frequently. But I'd also like to say that we're also science has advanced so much that we're detecting cancers better, and certainly for one of the cancers mentioned, colorectal cancer, just last year the American Cancer Society recommended people who are at average risk for colon cancer should get screened at the age of 45 instead of 50, so they reduced their screening age guideline, perhaps based on the study because they were seeing it more in younger patients. But again, I don't know if it's because we're diagnosing people at younger ages and maybe they're more knowledgeable about their family histories. Families are talking about what, relatives have succumbed to, and people are feeling, empowered to go to their primary care physicians with their family history, and with that knowledge, we're screening and detecting cancer earlier. So again, I think it's a combination of, earlier detection with better screening techniques, and then also recognizing these risk factors.
And risk factors, you mean lifestyle risk factors?
Exactly. So we can't change our genes. Certainly you need to know about your family history of certain cancers that might be hereditary, like breast cancer can run in families, certain colon cancers can run in families. But that you can't change. But other risk factors, particularly for colon cancer, obesity is one. Diet, reduced meat intake is related to, decreasing colon cancer risk. So knowing your risk factors can help you gauge your risk for cancers, and you should certainly talk to your doctor about these things.
In terms of diet, what should people, and this I'm sure would apply to all age groups who want to be proactive about preventing getting cancer, what things should we be eliminating from our diet or increasing in our diet to optimize our health and sort of, as much as possible guard against getting cancer?
So I always advise my patients just to have a well-balanced diet, and, the American Cancer Society recommends a certain amount of protein and minimal carbohydrates, and, not all cancers are necessarily associated with dietary intake, but for those that are, I would say, minimize meat intake, minimize alcohol intake, and just use your judgment, and nothing kind of don't overindulge, nothing in excess. Unfortunately, when I see patients who have already been diagnosed with cancer and they want to change their diet, I support them in doing that. But usually by the time I'm seeing patients with a cancer diagnosis, when patients want to change their diet to help manage the cancer, there's a lot less evidence to say that that's really going to help.
Wow. So it's really about being proactive before you even think you may have cancer.
Absolutely. Prevention is key. And there are certain cancers which we have early detection modalities, whether it's breast cancer and mammograms, or colon cancer and colonoscopies, or prostate cancer and PSA and digital rectal exams. These are the cancers for which there are certain screening modalities that we can recommend for certain age groups, for certain people at risk, depending on their family history. And earlier detection really means that we can likely cure it or at least treat it better.
You mentioned earlier the risk factors for colorectal cancer, one of them being reducing your meat intake. Would that also help with, I guess, reducing risk for other types of cancers as well?
I think the jury's out, and certainly maintaining a healthy diet is something I advocate. For other cancers, I think that the statistics are best for colon cancer. There might be some literature for breast cancer, but it's not as strong. But for colon cancer, I think it's the strongest, that if you could limit your meat intake and not completely nullify it, but just limit it. But you also have to look at your other risk factors and whether you have a family history of colon cancer, a family history of inflammatory bowel disease. Those are things that also increase your risk for colon cancer, that is.
Gotcha. One of the other things the study mentioned was that the rise in the rate of kidney cancers was especially striking among millennials. They were 5 times as likely as baby boomers to develop cancer in the kidneys. Any idea why on earth that particular cancer would be increasing so much in millennials?
Yeah, that's an interesting finding, and kidney cancer could be related to obesity, but I think more likely than not is that we're doing more imaging in younger patients for other reasons. So if you go to a clinic and you are coughing and you have a chest CT, or if you go to a clinic and you have belly pain and you have an abdominal CT, sometimes kidney cancers are types of cancers that are what we call incidentalomas. They're picked up for other reasons. And I think for the kidney cancer issue, it's just because we're doing more imaging and they're being incidentally picked up. But it is one of the cancers that can be associated with obesity.
Interesting. So I definitely know somebody who I went to school with that had colorectal cancer. And a lot of people these days, I know actually people who've had colorectal cancer, breast cancer, other forms of cancer, a lot of people these days are being very open about their diagnosis and sharing on social media, sort of trying to demystify the idea of cancer and show that it doesn't really discriminate, although you may have more of a chance depending on what your background is. When you talk to your patients about coping with the diagnosis, how do you advise them in terms of connecting with family, connecting with friends, even connecting with strangers to form a support system to help them get through a very serious diagnosis?
Wow. So, yeah, I mean, getting through a cancer diagnosis and treatment, you need a tremendous amount of support. And, I kind of gauge where each patient is in terms of, when they're diagnosed, how much research they've done, what background information they have about it, what they're willing to disclose. But in general, I find that my patients who are able to articulate it and bring in kind of the troops to help them get through this surprise period in their life, they tend to cope with a cancer diagnosis and treatment so much better. But you really have to just gauge where the person's at in terms of receiving the information, and whether it's referring them to support groups. I myself have an interest in kind of young adults and adolescents and millennials with cancer, and I, amongst my own patients, will refer them to each other to help them kind of talk things through. And, someone who's starting chemotherapy and has fears about, the side effects of chemotherapy, I can outline them when I see them in my office visit, but hearing it from someone who's been through it, who's their age, who knows how it might interrupt their school or work schedule means so much more than I think hearing it from me. So I certainly encourage, particularly my younger patients, to use their network to help them cope with the diagnosis and future treatments. It's definitely not easy.
Certainly. And if you're the loved one of a young adult who has been diagnosed with cancer, what's your advice for a loved one, be it a relative or significant other or just a friend who wants to help this person on this journey?
So my advice for them is obviously to support their loved one and their partner, but I also think they need to recognize what they also need themselves as a caregiver. And a lot of what I do is kind of managing expectations and helping caregivers address their own health issues, because once their partner, loved one, is diagnosed with cancer, a lot of their energies now are focused on that individual. But I don't want that to happen in the face of them neglecting themselves and their own needs. And caregiver support is also a big issue in supporting patients with cancer, because caregivers are also dealing with a lot in supporting their loved ones, and they need to be supported in and of their own rights. And sometimes, I'll have patients who maybe need to come to the clinic and spend 2 or 3 hours with me, and we have a day hospital at Weill Cornell, and I'll tell the caregiver, this is their time to kind of go and run their errands or do the things that they need to do, because their health, whether it's emotional, mental, or even physical, is equally as important. So I would just encourage them not to neglect themselves.
That's awesome advice. So one of the cancers that was not a part of the study, but also notable in terms of its prevalence, is breast cancer. And I know that is something you have a background in treating as well. What is interesting to me is that I did not see breast cancer among those 6 obesity-related cancers that are found to be more prevalent in young adults these days. But it was also interesting to me to realize that breast cancer doesn't actually discriminate in terms of age and gender. At the same time, another study found that 25,000 women under the age of 45 develop breast cancer every year. And I myself know a number of women in my own age group who have developed breast cancer, and you would never know it looking at them. They're generally fit, healthy-looking people. So, Dr. Phillips, could you explain sort of the risk factors that go along with developing or potentially developing breast cancer, especially in young adults and millennials?
Sure. So, breast cancer generally is a cancer of older women, but like you said, we're diagnosing it among younger women every day. And there's an interesting, what we call racial disparity in the diagnosis of breast cancer. I'm an African-American oncologist, and these are kind of issues near and dear to my heart. But although breast cancer overall is declining and less common among Black women, if you look at rates of breast cancer among women, let's say less than 40, it's actually more common among Black women than it is among Caucasian women. And sometimes these women don't even have a family history of breast cancer, so you wouldn't necessarily know it in terms of reviewing risk profiles. So breast cancer is challenging, and I would say particularly for young Black women, because On average, if you're less than 40, breast cancer is actually more common among Black women than Caucasian women. The diagnostic techniques or preventive techniques we have to screen for breast cancer, particularly mammograms, can sometimes be less sensitive in young women who have denser breasts. So I would just encourage young women who definitely have a family history, because that's probably the strongest risk factor for breast cancer. But even if you don't have a family history of breast cancer, if you notice anything abnormal about your self-breast exam, bring it to the attention of your primary care doctor. And it's not uncommon to go through ultrasounds and mammograms and even breast MRIs these days to kind of get to the bottom line. But I think as women, we know we're perhaps more in tune to our health and our bodies, and if we know something is wrong and something doesn't feel right, we just have to see it through until we have an answer that is clear for us.
When would you suggest women begin getting mammograms or doing self-breast examinations in terms of their age?
So I always kind of on the record have to follow the American Cancer Society or the U.S. Preventive Health Task Force's recommendations, and these things are always changing. I actually think recently maybe they've recommended, one of the agencies, I forget which one, has recommended, probably the U.S. Preventive Health Task Force has recommended against breast self-exams. But I would recommend for women, depending if they have a family history, certainly start breast self-exams and bringing it to the attention of your primary care doctor, perhaps 10 years prior to when your mother or aunt or sister was diagnosed, if you have a very strong family history. And then based on that, your doctor will make recommendations of either ultrasounds or mammograms for screening. If you don't have a positive family history, I would say under the age of 40, you should start doing your breast self-exams, and at 40, I would start getting a mammogram. And you should talk with your primary care doctor about the frequency about which you should have that, and whether that should be supplemented with an ultrasound as well, because, again, mammograms can sometimes be hard to interpret in younger women with denser breasts.
Interesting. In terms of the cancers that we are seeing at an increasing rate in young adults, and this is totally an uneducated sort of question for somebody in your profession, but do you see more women or more men come into your office in the younger age groups when they have cancer diagnosis?
Oh boy, I would say I see more women in general, but it really depends on what type of cancer. And I recently just had a dear friend, a male friend, who was diagnosed with prostate cancer under the age of 50. And, you know, unlike his relatives who had a very strong family history of prostate cancer, he took it upon himself to kind of, with his first abnormal PSA, to get things investigated and get a biopsy when it was recommended. I don't want to stereotype men, but I think sometimes it can be harder for them to come to physicians with certain symptoms, particularly related to prostate or, you know, anything related to sexual health, that kind of thing. And I think men can sometimes be a little bit in denial and need the women in their life to kind of bring things to attention to doctors. But I would say in general I see more women, but sometimes I see men too, and I'm happy when they come, particularly when they come early.
Do you think men are in denial because of societal pressures and conditioning?
Absolutely. I think, you know, they have other pressures, other competing demands in their life, and they might dismiss a minor health symptom because they don't want to appear weakened or compromised, or if the evaluation is going to require certain compromising things, you know, whether it's a digital rectal exam to evaluate the prostate or a colonoscopy, which requires a prep that gives you lots of diarrhea, and then have, you know, a tube up your butt to look for polyps and that kind of stuff. I think men, again, not trying to generalize, might have a harder time with those things.
Okay, so last couple of questions. What's the best piece of advice you can think to give a young adult whose life has been disrupted by a cancer diagnosis?
Wow. I would say that you're not alone. Based on the study that, we've been talking about, cancer, although it is a disease of older people, we're seeing it increasingly commonly in younger people, and that you should reach out to your network, whether it's your physician, your family, your partner, your friends, whatever institutes support you, and look for that support that you need. When you're ready, also, you can, advocate on your own behalf and advocate for others based on your experience. And I know it's hard sharing a cancer diagnosis, but when the time is right, I think you'll get a tremendous amount of support from that network, and just that you're never alone.
Awesome. And in terms of prevention, just to drill that message home again, because I think it's really key people understand the environmental risk factors, which is something that we didn't talk too much about. What can some of those be, and how do we employ preventative measures to guard against some of those environmental risk factors that may also lead to some of these more prevalent forms of cancer in young adults?
So I guess by environmental risk factors, we're talking about obesity as part of the environment, your dietary intake, alcohol intake, smoking, or other exposures. And I would just say,
yeah, I was more talking
minimize
about those latter exposures, like the smoking and the alcohol, and even certain chemicals or ingredients in foods and things like that.
Yeah. So there's a lot of information now coming about ingredients in food and sugar kind of feeding cancer. And I honestly have to say, as a medical oncologist, I think the jury is still out on, again, a definitive causal link between, let's say, sugar and cancer. But certainly I recommend to all my patients that they should have a well-balanced diet. And by well-balanced, I would minimize sugar intake, minimize alcohol intake. And that's going to be for the patient individual in front of me to kind of gauge for themselves, and whether that's, one drink a week or a few drinks a week. I don't want to kind of say I prescribe a certain, recommendation, but I would just say a well-balanced diet with, limited meat intake, limited alcohol intake, limited sugar intake. But we're all human, and a lot of the research is still not definitive about the quantities of these things that could increase your risk of cancer. And your risk of cancer is not just dependent on these environmental exposures. It's also your genes. It's also on other things in the environment. So particularly when I see patients once they've been diagnosed and they said, oh, well, I have a patient with leukemia who wanted to have a birthday cake before coming in for her chemo. I'm not going to tell her she can't have a birthday cake with sugar or something like that at this point. And I don't want to make patients or people scared that they can't have sweets when they want it, but just use your judgment, everything in moderation, nothing in excess. Maintain a healthy activity level, exercise. That's very important, not just for cancer health, but your cardiovascular health, your mental health, your emotional health. And just achieving the right balance for you.
I've been told by other doctors that certain foods that cause inflammation can also be triggering for cancer. Is that something that you agree with?
Yeah, so again, we kind of read in the lay press that sugar feeds cancer, and particularly for my cancer patients who are on chemotherapy, we recommend that they avoid, high sugar intake, high carbohydrate loads.
How about dairy?
But we don't have, how about what?
Dairy?
Dairy, I think there's less information on in general. There's some reports about perhaps dairy and breast cancer or soy and breast cancer, but it's not definitive, is what I would say.
Gotcha. Were you about to say something else before I so rudely cut you off?
No, I don't think so. And it wasn't rude.
Okay. Okay, great.
At all.
Well, Dr. Phillips, it's been so great having somebody so experienced in this topic help us wade through it. I hope it's been helpful to our listeners. And are you on social media at all? If you are, do you want people to find you, or do you want to just remain anonymous and
I am not very much on social media. I do have a website, which is just my name, AdriennePhillipsMD.com, and I guess you can find me through the Weill Cornell Medicine or NewYork-Presbyterian Hospital Network.
Wonderful. Well, thank you so much. And for all of our listeners, you can follow us on Twitter, Facebook, and Instagram by searching Skooled or at Skooled Podcast, Skooled. Until next time, bye.